Facial paralysis can occur suddenly, sometimes mysteriously, often called Bell's palsy. It can occur after removing a tumor or following brain surgery, where the electrical pathways that control facial movement are interrupted. Half of the face stops moving. Patients lose their ability to smile, close their eye, blink, and even basic expressions become impossible. Beyond the physical limitations, the emotional and social impact is devastating. I've had patients lose their jobs because they couldn't look at a computer monitor due to constant eye twitching or closure. Others withdraw socially, avoiding the very human interactions we all need. The good news is that treatment is available for facial paralysis. However, facial reanimation surgery is highly specialized. There are only a handful of surgeons worldwide who regularly perform these procedures at an advanced level. Traditional approaches used a single source of electricity, nerve input, resulting in mass motion that often looked uncoordinated. Our team pioneered dual nerve transfers, using separate sources to target specific facial areas. This approach breaks up the movement, creating a more natural, coordinated expression. It's a technique that's been adopted globally over the past decade. My background in fine arts proves especially valuable in facial reanimation. Your face is seen by everyone. Every millimeter matters. There's nothing to hide. We often combine aesthetic surgery principles with functional reconstruction. For instance, when facial muscles shrink due to paralysis, we may use fat grafting to restore volume. For tissues that have dropped, a deep plane facelift can reposition them naturally. The face is central to human connection, and restoring that ability to express, to smile, to communicate naturally, that's what makes this work so profoundly rewarding.